hypothyroidism. In hypothyroidism, there are many cases. One of them is Hashimoto disease. Hashimoto disease is also autoimmune disease, and there are specific immunoglobulins or antibodies, but these antibodies in Hashimoto disease do not stimulate the thyroid stimulating hormone receptors. Instead, these antibodies in Hashimoto disease will attack the thyroid gland as a whole and destroy the cells and follicles of the thyroid gland, resulting in, first of all, thyroiditis or inflammation of thyroid gland, and then destruction of the gland as a whole, rendering the gland to be, as a whole, is about what? A fibrous tissue. So all the thyroid gland will be destroyed. And as a result of that, the manifestation, laboratory manifestation, will be decreased concentration of T4 and T3 because of the destruction or damage to the gland, which occur because immunoglobulins in Hashimoto disease, and elevation in thyroid stimulating hormone. Why the thyroid stimulating hormone is increased in the blood? Because there are no concentrations of T3 and T4, which cause negative feedback on the pituitary gland. So TSH will be released more by pituitary gland to stimulate the gland. Another abnormal or pathological condition belongs to hypothyroidism is the colloid goiter. Colloid goiter occurs because of what? Because of deficiency of iodine in the food of people. And some areas or some countries, the soil in some countries does not contain iodine in its nature. So all the vegetables or the plants will not contain the enough concentrations of iodine. So people in some countries will suffer from deficiency of iodine, and a condition will develop which is called colloid goiter. So in some countries it is endemic, so sometimes it is called endemic colloid goiter. So what are the signs will be of the colloid goiter? Because of lack of or decrease of iodine, this will lead to what? The thyroid stimulating hormone will stimulate thyroid gland to secrete T3 and T4, to secrete thyroxine and triiodothyronine. But there is no iodine, there is no iodide in the food stuff that the person consumes. So the result is large quantities of thyroglobulin is formed inside the follicles. This will cause the gland to be enlarged. The thyroid gland as a whole will enlarge about 10 to 20 times its normal size because of the overfilling of the follicle with thyroglobulin. Thyroglobulin is produced because of continuous stimulation of TSH on thyroid gland. But there will be no T3 and T4. There will be no thyroid hormones. Why is that? Because there is no enough iodine. So as a result, only increased concentration of thyroglobulin particles or molecules inside the thyroid hormone, but there is no enough thyroid hormones to be created, and there will be no negative feedback on pituitary gland. So the TSH will increase drastically, and T3 and T4 will be decreased. Sometimes there will be another type of hypothyroidism or colloid goiter. It is not due to lack of the iodine in the foodstuff. There is iodine in the foodstuff, but colloid goiter might develop in some persons, in some patients. This type is called idiopathic goiter. So what are the suggested or expected reasons for idiopathic goiter? It's true that iodine is found, okay, and the person is normal, but there might be defect in, first, in peroxidase enzymes. You remember the thyroid peroxidase enzyme, which is important for the binding of iodides with tyrosine. So sometimes peroxidase enzyme is not adequately formed inside the thyroid gland, or the reason might be defect in trapping of iodine or iodide to the cell. So iodine is also present in the foodstuff, but it is not be taken to the inside of the thyroid cells. So these two reasons might lead to idiopathic goiter. So the result will be, of course, formation of colloid or thyroglobulin inside the cells of the follicles of thyroid gland, but not adequate amount of the thyroid hormones are formed. For these two reasons, idiopathic goiter might develop. Another reason is, you know that we have said when iodide is bind with what? With tyrosine, it will form monoiodotyrosine. And monoiodotyrosine with other molecule of monoiodotyrosine will create diiodotyrosine. And two diiodotyrosine with one another diiodotyrosine will create thyroxine. But some molecules which are previously which are previously iodinated will remain as monoiodotyrosine molecules. So iodine must be removed from these remaining molecules by deiodinase enzymes inside the cells. So if there is defect in deiodinase enzymes, the iodide will not be removed from the remaining molecules, and this will lead to deficiency-like condition of iodine, and idiopathic goiter will be developed. Now let's make a fast recall comparison between the hyperthyroidism and hypothyroidism. Let's make a recall or remembering comparison. Hyperthyroidism. Hypothyroidism. In hyperthyroidism, we have two conditions: grave disease and thyroid adenoma. While in hypothyroidism, we have Hashimoto disease and colloid goiter. Graves' disease is autoimmune disease and it is caused by thyroid stimulating immunoglobulins. Let's write them like that. Graves' disease is caused by thyroid stimulating immunoglobulins. And Hashimoto disease is also caused by antibodies. Colloid goiter is caused by lack or deficiency of iodine. In Hashimoto disease, the antibodies will destroy the gland, while in a Graves' disease, the antibodies or thyroid stimulating immunoglobulins, will stimulate the receptors of thyroid stimulating hormone. The manifestations will be in both hypothyroidism and hyperthyroidism. The laboratory manifestations will be an increased or elevated concentrations of T3 and T4 with decreased concentration of thyroid stimulating hormone. While in both conditions of hypothyroidism, there will be decreased in thyroxine and triiodothyronine with elevated concentration of thyroid stimulating hormone. So we have two conditions in hyperthyroidism: Graves' disease, which is caused by thyroid stimulating immunoglobulins, and thyroid adenoma. In hyperthyroidism, in both cases, there will be elevated thyroid hormones with decreased thyroid stimulating hormone. While in hypothyroidism, while in Hashimoto disease or colloid goiter, for different reasons, for antibodies here or for lack or deficiency of iodine, there will be elevated concentrations of thyroid stimulating hormone and decreased concentration of thyroid hormones, which are triiodothyronine and thyroxine. Another important comparison: in Graves' disease, there is correlated condition, which is the exophthalmos. While in colloid goiter, there is what is called myxedema. exophthalmos in Graves' disease, protrusion of eyeballs, while myxedema is the accumulation of fluids under skin of the body. So there will be a frog-like sound, husky voice of the patient, and also bagging under the eye and swelling of the face due to edema under the cutaneous tissue because of accumulation of hyaluronic acid and chondroitin sulfate under the skin between the tissues. It is called myxedema. So that's all today for the thyroid gland. Thank you so much for your listening.